Welcome to the Medi, your trusted space for the simplified science-backed learning in the pharmacy, health and the medical science. So whether you are a student, educator or just a curious about how medicines work, you are in the right place. So from dosage forms like ointments and jellies to the deep dives into the pharmacology. So clinical tips and the traditional remedies like poultices. So we bring you clear explanation, smart visual designing to make a complex topic easy to understand here. So don't forget to subscribe and hit the bell icon so you never miss a dose of knowledge. So this is MediQueries where medicine meets the clarity. So let us enter into the topic. Today's topic is poultices. For centuries people have trusted to the nature for healing. So long before modern pharmaceuticals, soft warm applications made from the herbals, clay, flour brought relief to the pain, swelling and infections. So these simple yet powerful preparations are known as poultices. Today science is rediscovering their value, merging the traditional wisdom with the clinical care. But what exactly is a poultice? How it works? Let's explore the fascinating world of the poultice where moist heat meets the medicine. So let's start. So what is a poultice? Poultice is also known as cataplasm. It is in a soft, moist mass of plant material or a flower or a medical agent, so applied to the body to relieve the soreness, inflammation, infection or pain. So historically it is used in the Ayurveda, Unani, Chinese and folk medicines. Poultices are now also recognized in the clinical herbalism and the nursing care. So the term may sounds old fashioned, but the science behind the poultice lies in their moist heat delivery. So ability to draw out the infection and localize drug release here. So the poultices can be applied hot or cold directly on the skin or with a thin gas barrier. Okay. So let us see the mechanism of action. So mechanism of action, how poultice works means the effectiveness of the poultice lies in the thermal and the absorptive properties here. So a warm poultice increases the blood flow to the affected areas, which mainly promotes the vasodilation, which helps to deliver the immune cells and the oxygen for the faster healing. Okay, so the moisture in the poultice helps the soften the tissues and promotes the drainage of the pus or the toxins from boils, abscesses or infected wounds here. So the medical herbs or the actives in the poultice may provide the antimicrobial, anti-inflammatory or the allergic effects. So cold poultices on the other hand reduces the swelling and the numb localized pains. So this combination of temperature regulations, topical pharmacology and the moisture compresses action makes the poultice effective, especially in low resources or home care settings. So this combination of temperature regulations, topical pharmacology and the moist compress action makes a poultice effective, especially in low resources or home care settings. So what are the ingredients used in the poultice? So the poultice can be made from a wide variety of the natural or the pharmaceutical ingredients. So common herbal ingredients includes turmeric, neem leaves, linseeds, aloe vera, clay, activated charcoal, like that we will use. So first one is the turmeric, that is the curcuma longa. It's for its antiseptic and anti-inflammatory properties, and neem leaves are for their antibacterial effects, and linseed, that is the flax seeds, are a mustard for drawing the infections, and aloe vera, clay or activated charcoal for soothing and the absorption. So the pharmaceutical poultices may contain substances like magnesium sulfate, zinc oxide, or even antibiotics when prescribed. Okay, so the base may consist of bread, flour, oatmeal, or kaolin, so which holds the moisture and deliver the heat evenly here. So sometimes a honey or a glycerin is added to keep it sticky and improves the penetration rate here. So the preparation is designed to hold together, retain temperature and stay moisture for 20 to 30 minutes during the application. Okay. So how to prepare and apply a poultice means. So preparing a poultice is simply a careful process here. So first crush or grind the chosen herbal or the active ingredient and then mix it with a small amount of warm water or a carrier like glycerin or oil to form a thick paste here. So the paste is then spread on the clear piece of cloth or a gauze, okay, so which is folded and placed directly onto the affected area. Okay, so a hot water bag or a warm towel may be applied over it to retain the heat. So the poultices are generally left in a place for 15 to 30 minutes, after which the area should be cleaned. Okay, so in some infections multiple applications per day may be required, so always ensure the temperature is not too hot to avoid the burns, especially for elders or for pediatric patients. So if used correctly, the poultice can be a powerful supportive therapy here. So applications and the clinical uses. So the poultices are commonly used in treating the skin infections like boils, carbuncles, insect bites, sore muscles, abscesses, even joint pains. So for instance, a magnesium sulfate poultice is often used in the hospitals for reducing the inflammation from localized infections. In traditional medicine, turmeric or a neem poultice are used for infected wounds, while cold clay poultices are used for treating sprains and swellings, and veterinary medicines also use poultice in treating the hoof abscesses in horses. So because of the localized action, low cost and non-invasive nature, poultices are making a comeback in integrative and holistic healthcare. Advantages and limitations. The key advantages of the poultice are their ease of use, low cost, minimal side effects, and localized effects. So they are practically helpful when oral drugs are not preferred or when quick relief is needed. Okay. So additionally, herbal poultices avoids systemic drug exposure. So however, they have limitations like short shelf life, messy preparation, potential for microbial contamination, and lack of standardization in the doses. Over usage of the heat or the pressure may cause skin damage, and allergic reactions may occur with some plant-based ingredients. So proper hygiene, fresh preparation, and guidance from a health professionals are highly important to maximize their benefits safely here. So let us see one example of the poultice here, that is the kaolin poultice. It is a classical clay therapy in the modern medicine. So what is this kaolin poultice means? Kaolin poultice is in a traditional and still clinically relevant semi-solid preparation that uses kaolin, a natural occurring hydrated aluminum silicate clay here. So this preparation is applied warm to the skin to relieve the inflammation, draw out infections, soothe irritated tissues. Okay, kaolin is particularly well known for its absorptive and astringent properties, making it is suitable in case of boils, sprains, insect bites, and superficial infections. Okay, so though considered part of the traditional wound care, kaolin poultices have continued use in the emergency medicines, veterinary care, and a part of a support to dermatological therapy here. its ability to hold the heat and the moisture while maintaining a thick adhesive consistency make it ideal for targeted treatment here. Okay, so let us see the composition of the kaolin poultice. The standard kaolin poultice formula includes the kaolin BP, that is British pharmacopoeial grade, as the main ingredient, usually about 15 to 20% of the total mass here. So it is combined with the suitable base like glycerin, which act as a humectant to retain the moisture and soften the skin. The formulation often includes the boric acid and methyl salicylate or eucalyptus oil to provide a mild counter irritant effect. So these ingredients work synergistically. Kaolin acts as a drying agent. Glycerin helps prevents drying and cracking, and then added oils promotes the blood flowing and the pain relief here. Okay, so the final product is a thick, smooth and a spreadable one. Okay, so easily held in place or gauze or in muslin cloth. Okay, coming to the method of preparation. So the preparation of the kaolin poultice begins with the gentle heating of the kaolin and the glycerin to form a smooth, consistent paste. So if boric acid or the methyl salicylate is included, so they are dissolved in the base before the kaolin is added. Okay, so the mixture is stirred continuously until a thick lump-free mass is formed. So it is important not to overheat the mixer to avoid degradation of the active oils here. Okay, so once prepared, the poultice is either spread directly on a sterile gauze pad or between two layers of the muslin or linen cloths. Okay, so the warm poultice is then applied to the affected area and held in place with a light bandage. Okay, so it can be kept for 20 to 30 minutes and changed twice daily. So depending upon the severity of the condition, we will prefer like that. So what are the uses of this kaolin poultice? Means kaolin poultice are commonly used in the treatment of boils, sepsis, sprains, infected wounds like that. So they are especially effective in cases where there is a local swelling, pain or pus inflammation. Okay, kaolin poultices remains relevant in low resource settings, field hospitals, emergency kits, so where quick relief and the traditional methods are still valued. Okay, in modern medicines, the use of the poultice includes kaolin based ones is making a comeback, especially in the integrative medicines and complementary care here. So with growing interest in the natural, biodegradable and non-invasive treatments, kaolin poultices offers a practical solution in wound care and the inflammation control here. So as antibiotic resistance increases, localized therapies like poultices may help reduce the systemic antibiotics use here for students for pharmacy and the healthcare. So understanding these traditional formulations helps bridge classical compounding knowledge with contemporary clinical practices here. So the kaolin poultices remains an important and a respectable therapeutic form, so valued for their simplicity, effectiveness and the safety here. Okay, in conclusion, poultice bridge the gap between the traditional healing and the modern medicine here. So while they may appear rustic, their scientific basis in thermotherapy, pharmacology and the moisture therapy so makes them a powerful agent in wound care and the inflammation control. So today poultices are being re-examined for their role in the sustainable community-based integrative care models. So whether you are a healthcare professional, student or a caregiver, understanding how to properly use the poultice gives you an extra tool in healing and comfort here. So ancient remedies, when supported by the modern understanding, can still often profound relief.